Greetings, I'm Dr. Brandon Nielsen, and today I'm going to be making a video about the forward head posture. This is for a patient who works on the computer a lot, but you get to benefit from it as well. So in today's society, we see a lot of the forward head posture from computer work. A lot of us are at the computer, a lot of us at the desk. I also see this with hairstylists using their hands and leaning over, or dentists. But what happens is, like, here's the computer, you start out kind of sitting up nice and straight and tall, and then over time, you kind of start looking at the screen, and look at how much pressure is just right there in my neck. You can even see it. And so in order to compensate, you start looking up and tipping your head. Also, mechanics do this as well. They're looking under the car all day long. Well, this type of forward head posture leads to what is called a disc bulge. If it gets really extreme, you can have actually disc herniation or herniated disc. Most of my patients I see have disc bulges, and I've throughout the years recommended an exercise called the chicken neck. The chicken neck is an amazing exercise that helps stack up the vertebrae and relieve the pressure off the nerve and correct that disc bulge. Of course, you're going to need to get some chiropractic adjustments. Now, this is the way you do this, and you're going to sit up nice and straight and tall. You're going to have your chin kind of tucked on a level plane. This is the chicken neck, okay? And then you jet up forward, chicken neck. Now, with the row, I'll show you this from the side posture. The row, so that's the chicken neck. Okay, nice and slow. The row is different, and the only thing that differs is we add our hands. And what that does is when the shoulders are involved, this is a phenomenal exercise, all right? Because it helps stretch the shoulders, especially as people have been sitting there all day long. Now, both of them work. However, this is just with the shoulder involvement called the row. So when the chin goes back, the hands go forward. When the chin goes back, the hands go forward. When the chin goes forward, the hands come back. Very easily. Sit up nice and straight and tall. Here we are. Okay, and that's called the row. Now, what I'd recommend is doing the row about 13 times. So that was 1, 2, right? This would be considered 1, 2. Okay, so I'd recommend doing that 13 times, 3 times a day. If it's really bad, you're going to do that like every hour. And sometimes if you can't feel it as much in the neck, then do the chicken neck. So you could do like 13 rows, 13 chicken necks. All right, I hope this helps. I'm Dr. Brandon Nielsen. Remember this, to live in wholeness every day. And if you have any questions, just go ahead and post them down right below.